Understanding stroke. What it means for your brain. A stroke is like a brain attack. It happens very suddenly. It can affect anyone at any age. Blood flow to a part of your brain stops, or a blood vessel in the brain bursts. This is a serious medical condition. Your brain needs quick help. Every second counts. Without blood flow, brain cells die. These cells need oxygen to live. Oxygen is carried by your blood. Without oxygen, brain cells die. This can happen in minutes. The damage can be permanent. It can affect body functions, like moving, speaking, or thinking. There are two main kinds of stroke. The most common is an ischemic stroke. This happens when a blood clot blocks an artery. The artery carries blood to the brain. The other kind is a hemorrhagic stroke. This is when a blood vessel breaks. It bleeds into or around the brain. Both types damage brain cells. A stroke is always a medical emergency. Think of it like a fire in your brain. The longer it takes to get help, the more damage occurs. Recognizing symptoms quickly is key. Calling emergency services immediately is vital. Fast treatment can save lives. It can also reduce long-term disability. Never wait to see if symptoms go away. Recognizing the warning signs. Act fast. Knowing the signs of a stroke is crucial. It can help you save a life, maybe your own or someone else's. There is an easy way to remember. Use the acronym FAST. Each letter stands for a key sign. Learn these signs well. Share this knowledge with your family. F stands for face drooping. One side of the face may droop, or it might feel numb. Ask the person to smile. Is their smile uneven or lopsided? This is a clear warning sign. Do not ignore this symptom. It signals something is wrong. A stands for arm weakness. One arm may feel weak or numb. Ask the person to raise both arms. Does one arm drift downward? Or can they not lift one arm at all? This weakness can also affect a leg. Sudden loss of strength is serious. It points towards a possible stroke. S stands for speech difficulty. Speech may be slurred or strange. The person may be hard to understand, or they might not be able to speak at all. Ask them to repeat a simple sentence, like "the sky is blue." Can they say it clearly? T means time to call emergency services now. The root causes why strokes occur. Many strokes are linked to high blood pressure. This condition is often called hypertension. It means your blood pushes too hard. It pushes against your artery walls. This can damage and weaken arteries. Weakened arteries can burst or clog more easily. High blood pressure often has no symptoms, so get your blood pressure checked regularly. Lifestyle choices play a big role. Smoking tobacco is a major risk factor. It damages blood vessels significantly. It makes clots more likely to form. An unhealthy diet also contributes. Too much salt, sugar, and bad fats are harmful. Lack of regular physical activity is another risk. These factors can be changed. Certain medical conditions increase stroke risk. Diabetes is one such condition. It can damage blood vessels over time. High cholesterol is another concern. Cholesterol can build up in arteries. This buildup is called plaque. It narrows the arteries. Atrial fibrillation, an irregular heartbeat, also raises risk. Some risk factors cannot be changed. Age is one of them. The risk of stroke increases as you get older. Family history also plays a part. If close relatives had strokes, your risk may be higher. Having had a previous stroke or TIA, mini-stroke, increases risk. A TIA is a transient ischemic attack. Knowing your risks helps manage them. Pathways to recovery, treatment, and prevention. If a stroke is caused by a clot, ischemic, doctors work fast. They may use a powerful medicine. This medicine can dissolve the clot. It is called TPA, or tissue plasminogen activator. It must be given within a few hours. Sometimes doctors perform a procedure. They can physically remove the clot. This is called a mechanical thrombectomy. If the stroke is from a bleed, hemorrhagic, treatment differs. The main goal is to stop the bleeding. Doctors need to control the pressure in the brain. Medicines can help reduce blood pressure. Sometimes surgery is needed. Surgery can repair the broken blood vessel, or it can relieve pressure on the brain. Fast action limits brain damage. After a stroke, recovery and rehabilitation begin. This helps people regain lost abilities. Physical therapy helps with movement and balance. Occupational therapy helps with daily tasks, like dressing or cooking. Speech therapy helps with communication. Medications may be prescribed. These can help prevent another stroke. Prevention is the best medicine for stroke. Live a healthy lifestyle. Eat a balanced diet with fruits and vegetables. Exercise regularly. If you smoke, try to quit. Limit alcohol consumption. Manage your medical conditions. Control high blood pressure, diabetes, and cholesterol. Have regular medical checkups.